My name is Professor Marion Mutugi. I'm a biomedical scientist. I'm actually a medical geneticist. And I have been working in the field of research and higher education for 30-something years, almost 40 years. I am currently the Vice Chancellor of Amref International University, the inaugural Vice Chancellor. It's a privilege to be at a position of setting the foundation for this premier Pan-African institution. We have identified the niche of health sciences as our preferred area of operations. This is not by chance, because Amref, our sponsor, has been operating in the area of health, particularly public and community health, for over 60 years. And during this period, certain needs have been identified. For example, we concentrate on curative medicine, curative health. But as a university, we have decided to concentrate on promotive health, promoting good health, preventing ill health, preventive health, rehabilitative health, and palliative health, where we recognize that there are times that one has terminal illness, or maybe in geriatric cases, they are old people at the end of their lives, and we want to add years to their lives. So we as a university have decided to concentrate on promotive, preventive, rehabilitative, and palliative health. Having identified our niche, health journalism falls in both promotive health, preventive health, rehabilitative health, and palliative health. I will give us a few examples. We are talking about COVID. We have noticed that there is a lot of stigma around COVID, that people who are either infected, suspected to be infected, associated with those who are infected, or people who are in professions of high risk, for example, healthcare workers, are facing stigma. And that is around promotive, preventive, and also rehabilitative health. You see, journalism is about informing. I understand there are people who are called publics, groups of people who listen to you, who hear you, who hang on to your every word, who have decided that you tell them the truth to inform their decisions. But we believe that in health journalism, we need to go beyond that. Other than informing, it is important to go beyond informing to advocacy and influencing, because journalists and health journalists are not only informers, but they are advocates and they are influencers. I will give an example. We're talking about wearing of masks. So when we see a journalist who we identify with, we know them, we see them on TV, we see them in media, we feel like we know them, they are like our buddies. When we see them wearing masks, then of course I will wear a mask. They are influencers in public health. And so we got to the question, for health journalism to play the role of influencers in terms of promoting good health, preventing ill health, rehabilitative health, and palliative health, do we get a doctor or a healthcare worker and train them in journalism? Or do we take a journalist and train them in health issues, pertinent health issues? Both can work. We know some journalists who are health journalists whose first training is in health. They are there. But they are few and far between. And so we thought that we want to explore the idea of journalists who have an interest in health and giving them, just topping up on pertinent issues in health, topical issues of public health importance, so that they can not just inform, but they can accurately and adequately influence their publics. And that is how the idea of health journalism came up. The course covers issues of public health importance. It covers history of public health so that we know where we're coming from, so that we can understand where we are and we can plan for where we're going. It also covers the basics issues of public health. For example, the determinants of health. For example, there is vulnerability to ill health. There is gender vulnerability. There is poverty vulnerability. There is crisis vulnerability. There is age vulnerability. For example, we are hearing with COVID that there are people who are vulnerable because they have underlying conditions. So there are all those vulnerabilities, so that you can understand your publics. Because you know your publics, you know some media publics are the older people. Like I know my mother listens to certain media houses and platforms more than others, so that you can understand your publics and you can be able to target your messages appropriately to those publics. Telling the youth to stay at home during COVID is a hard sell. But telling an older person to stay at home, they are more than happy to stay at home. Anyway, they stay at home most of the time. So those are the things that we talk about. We talk about ethics in public health. I am particularly passionate about ethics because ethics is what is right, what is wrong, what is acceptable, what is not acceptable. For example, is it acceptable to show the distressed face of a person who is infected with a debilitating illness in their last stages? Or should you hide their face? The ethics around health journalism is so important because it is so easy to violate the privacy and the confidentiality of the cases you report on. And instead of sending out the message of hope, you send a message of fear, a message of anger, and so forth. So you really, those are some of the areas we capture. But we also give hard science. For example, it would be unfortunate for us to talk about malaria as a virus. Malaria is caused by a protozoan. So little things like that. Issues of public health importance like malaria, like HIV, like cholera, like COVID. We want you to get the basics. What is it? So that you do not embarrass yourself. And you talk about COVID as a bacteria, and yet it's a virus. Amref International University chooses the programs it offers as a response to people out there, the practitioners. So this course was launched to test the waters because we got vibes from journalists that they felt there was a gap in the technical health areas. Journalists who are passionate about health matters, who are already practitioners in health journalism. And so it was in response. We got a representative of health journalists to come and tell us what the needs were. And that is how we created the program. Our motto as a university is to inspire lasting change. Some of the things we see in media give us anger, elicit our anger, but that's temporary. We cannot be angry all the time. It may be elicit us to come out on the streets and shout, but we cannot do that all the time. But we as a university want to inspire lasting change. We want to inculcate health issues and health approaches in public health, in promotive, preventive, rehabilitative, and palliative health. To some degree also curative health. For example, when we talk about medical negligence and malpractice, it is I need to know as a patient that I have rights. The healthcare practitioner needs to do certain procedures. For example, if I'm going into operation, before they put me under, they must ask me my name. They have it in the file, but they must ask me my name just to confirm it is myself. If I am unconscious, there are certain protocols that need to be followed. So as health journalists, I believe with that information, then you can bring out to your public so that I, who is your fan, because you are our fans, we are, we really look up to you. Then you can inform me of my rights so that when I go to the hospital and I'm seeking care, I can be able to know my rights so that we are not reactive to malpractice and negligence, but we are preventive. It is important for health journalists to recognize that they are not just informers, but they are influencers. And recognize that their reporting is going to influence their publics for good or for otherwise. My ideal health journalist is a journalist who will report or who will give their publics information, whether good or bad, but at the end it will elicit action for good health. Then that calls upon health journalists who are not just working for money, but who are passionate and recognize their high calling of not just reporting and informing, but advocating for public health and for influencing the publics to good health. If you are a health journalist in Africa or intend to take up health journalism, particularly in Africa, I want to tell you, when you take this course, you will be transformed. You will be fulfilled because you will go home knowing that you have not just informed people, but you have transformed their lives by influencing their decisions in public health.